The term plastic surgery was derived from the Greek word plasticus, which actually means to mold. And this is quite appropriate considering that the idea of shaping and sculpting is paramount to plastic surgery. Many historians agree that the first recorded account of reconstructive plastic surgery was documented in ancient Indian Sanskrit texts. Using mutilation as a form of punishment and humiliation was quite common. The Hindu author Shashrata wrote about the reconstruction of earlobes and noses using skin from other parts of the face, like the cheek and forehead. Evolution of plastic surgery. The Byzantine physician Oribasius was also an important historical figure when it came to the evolution of plastic surgery. In the 4th century, Oribasius wrote at length about different reconstructive procedures in his medical encyclopedia called Synagogue Medicae. In his writing, Oribasius demonstrated his insight into important techniques such as using flaps to avoid the distortion of facial features, in the process of creating tensionless suture lines. Oribasius' work in wound management and facial reconstruction remains an important contribution to the plastic surgery. In the late 1800s, anesthesia was introduced as part of the practice of performing plastic surgery, and eventually the procedure became more common and less risky. It was not until World War I that these reconstructive procedures became slightly mainstream because of necessity. During World War I, doctors were called upon to treat a large number of individuals who had experienced severe head injuries, and as a result, were often missing noses, ears, lips, and other body parts. Procedures continued to evolve, but plastic surgery wasn't truly recognized or defined until two European surgeons named Jacques Melniak and Gustave Afrique founded the American Society of Plastic and Reconstructive Surgeons, which is now known as the American Society of Plastic Surgeons, or ASPS. During World War II, the popularity of plastic surgery continued to grow and become more advanced. During this time, surgeons learned to perform the procedures with speed, precision, and accuracy, and this allowed more people than ever before to benefit from the surgery. These days, plastic surgery continues to improve and evolve, and this continued evolution has allowed millions of people to benefit from the procedures, both externally and internally.